Now I request Dr. Imran Pasha, Reader, Department of Public Health
Thank
Dentistry,
you.
member and coordinator of Yenepoya Dental Education Unit, to speak on case-based learning.
A warm good morning to good afternoon to everybody. It's already 12 o'clock. Yes, today I'm going to speak about case-based learning in interprofessional education. A lot you have learned today on the principles. You have learned on how IPA has to be set up in a university, in a college, and there are a lot of doubts in your mind how this can be done. And I can see there are a lot of questions in the chat box. Well, I can I remember my journey at the FEMA Fellowship on the first day of the program. Because I come from a public health dentistry background, it becomes easier for me to think about a project where I can involve multiple number of professions. I can cite multiple number of examples within my department where we are doing a lot of collaborations, a lot of collaborative work. But it took some time for me to understand what we are doing. Sometimes they all put together, we are all working in silos. We are all working as a various health professionals. What we need is the interprofessional education system to be incorporated in the curriculum so that our students learn that we can learn a lot when we are learning with, from, and about each other. Let me rephrase the sentence again: learning with, from, and about each other. This is the whole principle behind the interprofessional education. I think when WHO started this way back in the 1940s, 50s, 70s, there has been a lot of effort which has been put together, and Dr. John Gilbert sir, Dr. Professor Siraj sir has put a lot of efforts in this. And when I went there, it changed the whole perspective of mine. And yes, we have started small steps in this. I am not trying to say that tomorrow we are going to have an IPE module which has been built up in the system. No, this is a small beginning, and we are going to learn from our own experiences how to go about this. And I am sure with Dr. Akhtar Hussain sir's support, which has always been there, and Dr. C.V. Raghuveer sir, who's always been passionate, and I think his support has always been there. And also all the statutory officers, right from the Vice Chancellor to the registrars, and also my own education unit, that is the Yenepoya Dental Education Unit, and the CHPE members will contribute a lot. May not be in the immediate future, but in the long run, we will all learn to collaborate with each other and try to bring in changes. So now a practical experience: how do we incorporate this curriculum or IPE in our curriculum? Now, case-based learning is one of the teaching learning experience which you can put in, which you can embed for the students as well as for the faculties. Though case-based learning is not very easy, I do not want to go into the pedagogic approach where people may not understand. So I have picked up the case-based learning, which is one of the difficult process in terms of IPE, because literatures are still coming in about case-based learning. But though it's an interesting tool, as I continue my talk on case-based learning, you will understand what the students' perspective are on case-based learning. On one end it is good, on the other end you will come to know. But case-based learning is one of the teaching learning experiences in a small group which we can utilize to give the student that experience of interprofessional education. Simulation is also one of the very big things. So we have in the few months time we will have our own website which will come up where all these passive modules also will be put up on interprofessional education. So it is a beginning which we have started. I hope all will understand in the long run. So let us look into case-based learning, what exactly it is. Case-based learning is an educational paradigm, and I mean the word paradigm, closely related to the more common problem-based learning. You can tell that it is case-based learning is a sister or a brother of problem-based learning, but they are quietly two different aspects. They are completely different when the teaching learning exercises are concerned. This problem-based approach is an andragogical method, that is the adult teaching learning. That's what we call as a self-directed learning. These are all the words which we use in the field of medical education, posing contextualized questions that are based upon real life problems. that may be clinical or non-clinical. That sums up, if you're from a non-clinical department, can I use case-based scenarios? Definitely the answer is yes. If you're from a clinical department, the answer is yes. And will it be able to understand interprofessional education? The answer is yes. Now, coming to the definition, I went around searching for definition, landed upon to a lot of these ones. I found this given by Cardiff University, a little easier to understand. Case-based learning is backed up and reinforced by a variety of interlinked learning opportunities, including seminars, life sciences resources, lectures, dissection, clinical skills practice, small group learning, individual study, and patient focused learning out in the community. So this is what exactly is case-based learning is all about. Coming to case-based learning, its main traits are actually derived from the problem-based learning, that are a case is there, a problem is there, and the student will use an inquiry-based approach to stimulate and underpin the acquisition of the important three skills, that is the knowledge, skills, and attitudes. That is the plus point when we consider CBL. And the other opportunities like intrinsic and extrinsic motivation is developed, allowing individualized learning, encourages self-evaluation and critical reflection, allows scientific inquiry and development of support provision for their conclusions, integration of knowledge and practice, development of the learning skills. CBE allows to develop a collaborative, team-based approach to their education. So basically, this is what it will do when we are going to teach a case-based learning to our students. Now, let me, my case-based learning lecture will not be, complete if I don't take up this point, that is case-based learning versus the problem-based learning. I have put up only two important differences. That is the fundamental difference in the problem-based learning requires no prior experience or understanding in the subject matter, whereas the case-based learning requires the students to have a degree of a prior knowledge that can then assist in solving the problem. In problem-based learning, the problem derives the learning, whereas in case-based format requires the students to recall the previously covered materials to solve the clinical cases which are based on the clinical practice. Now, these are the fundamental difference between a case-based learning and a problem-based learning, which will allow the students to bring in the collaborative expertise. Now, if there are certain things which he's not know and he knows that, that person can give me a more insight into it, like, a person does not know about a rehabilitation process which can happen. And, he can always ask a physiotherapy person, how much time does it take for the rehabilitation to complete, or how long will it take the rehabilitation process to reach to a certain level. Now, if I say rehabilitation, it may not be in the months or days. Even the physiotherapist may not be able to give the certain timeline, but he can at least tell you by in terms of percentages how much fit, so the doctor can plan his treatment strategies based on his input. Now, this is the way an interprofessional education can be brought about. And case-based learning, when I went into one of the workshops, we had students from medical, dental, nursing, and physiotherapy. It was wonderful. One of the medical students, just stood up and answered to a question where he said, I really did not know what a dentist do. I do not want to mean anything. He did not really know what a dentist can play a role, in a medical scenario. This was his opinion. We have to understand, we are all learning the entire entire education in silos. So, case-based learning can bring all these professions together and make certain differences. Now, the one more important aspect is case-based learning versus traditional lecture format. See, again, my lecture will not complete without emphasizing on what is the difference between traditional lecture format and CBL. I have literature searched a lot of literatures. CBL, in most of the literature, students have found it very, very enjoyable, and they really like the format. They really wanted to do a lot of case-based learning in their scenarios. But when we asked about them about the traditional learning format, this is where it was interesting for me. It was more helpful for them for preparing written exams. I have students, who will always tell this, we just have to pass the exam. We need to make that, change in students mindset, that it's not about just passing the exams. It's about learning the skill set improvement, as well as attitudinal change. Now this was a study done, this was an interesting result which the students gave. um, Now coming to what this case based learning can add to our curriculum, that is, how can it change? uh, in the literature, case based learning, it's been put as one of the dynamic curriculum, because it allows students to develop collaborative, team based approach to their education and their profession. And also, if I have to go back into the CBME terms, it allows for vertical and horizontal integration of the syllabus. One of the best examples, which was developed by University of Rochester, which called as a double helix curriculum. Though I tried to understand what was double helix curriculum, what I could get from it is it really helped them integrate basic sciences as well as the clinical sciences, and also various other improvements in their own curriculum. They have been doing this curriculum for quite a long time. Now, when it comes to case-based learning, do we have to appoint an expert in case-based learning versus non-expert tutors? Because I'm a public health dentist, you would like to use the existing resources within our university, so that we can improve. So I looked at into this concept as well, whether we need an expert in the field of case-based learning to teach the students. Well, expert tutors, what the research says is, students led by expert had higher test scores and levels of learner satisfaction. That is one part. But when we use a tutor flexibility and spend less time in teaching preparation, and they acted as the best facilitators. Now, if I have to go back, into all these things, we need facilitators when it comes to the interprofessional education. We do not want to spoon feed them. We do not want to tell them, this is what you have to do, this is what you can do it, this is what you cannot do it. We have to act as a facilitator, so that they have best experience. Now, one of the questions asked to Dr. Abhay Nirgade sir was, what to do when we have a difficult conversation, when we are in an ethical dilemma, what can we do? We do put the students in all these types of ethical dilemma. Now, for my understanding, when we put them in best of the best ethical dilemmas, the students come out with an easier and a simpler solution to these problems. That's what the interprofessional education does to the curriculum. The difficult conversations are always difficult, because two different professionals will not agree. I can tell you, Dr. Akhtar Hussain sir stressed on it, our vice chancellor sir stressed on it, Dr. Raghuveer sir also has stressed on it. The difficult conversation, how to get this difficult conversation done. We might have a lot of jitteriness, should I or should I not? So the students will be put in, when we talk about interprofessional curriculum, they will be put in all these difficult conversations, so that they also become a better communicator, and they try to solve these issues in a much better way than we are currently. Now, coming to structured versus unstructured cases, this also has to be answered, because I also have one of the exercises in my Google Classroom curriculum, that most of the medical students did prefer an unstructured approach to their cases, because when we have a structured case, we already have given them the directions. This is how we have to do it. It's basically like we have given them the leading question. They just have to sit and answer. The students will never enjoy it. So an unstructured format will definitely help them develop all these competencies. Now we can debate pluses and minus, but we can always decide as a teacher what kind of, whether I want to give a structured format or an unstructured format. Well, I leave it to the teachers to decide what kind to be given. But if you ask me, I would definitely give them an unstructured format, because it will help them to grow as a professional. Coming to flexible delivery and the case-based learning, trust me, before COVID era, if you would have asked me, what do you think about computer learning and the other ways of learning, I had a different opinion. COVID has changed the entire scenario, and I stress this point to all across. It has made our life easier, because we can use the technology to deliver the interprofessional education. I mean to say, not in the long run, at least to begin with, we can use these, because we will find a lot of difficulties in putting different professions together at one slot in one particular place. It can happen at the bedside in a small way, but definitely when it comes to theoretical or the pedagogical approaches, it would be very difficult. But now we have a technology where we can use, where we can start. And I can proudly say that we were one of the universities which adopted this technology to a fuller extent. Our IT people can give, we are giving more than 500 lectures per day. This technology use in the case based learning will be definitely easier. And we have our learning management system like Engage. We can definitely use various other formats as well, like I have used in this case the Google Classroom. Definitely, it is flexible. Case based learning can be done with the computer based approaches as well. And we can have different people join together, to have small exercises done. Small discussion groups also can be created. Now, how exactly this case based learning happens? Now, I have a simple format. I have not gone in detail about it because it's already 12:20. I did not want to bore with a lot of theories. A simple framework is there, adopted from the Maastricht 7-jump process. Now, case, as a facilitator, you have to establish, or you can have a small group discussion within your students to establish a case as well. Case is analyzed by the group, that is the students or the faculty groups. It depends on whether it's a faculty development program or it is given to the student. And they sit and they brainstorm. They formulate the learning objectives. That's the best part of it. Disseminate the new findings, what and all the new things they have found about it, about the different professions, different curriculums, how they can join together to ultimately to lead to a better patient care. The group shares the results with the facilitator or to their tutor, or again they can spread this knowledge to multiple different places. So this is how interprofessional education can be delivered through a case-based learning. And case-based learning can also be used as one of the tools for teaching interprofessional education. I will not go in detail about how to write a good CBL, that is a case. I have one quote given by John Quelch that it says, basically it needs a start, a middle, and an end. And he continues, you also need an exciting problem and a sense of the personalities involved if you have to write a good case-based learning. And writing a case-based learning can also be a separate format where we can address a lot of these things. It is definitely interesting. We will definitely have another sessions on how to write a good case-based learning, definitely. But to stop at this, John Quelch has summarized it, how to write a good case-based learning. Now, that sums up my theoretical on how case-based learning can be used in interprofessional education. Now, coming to the exercise which has been put in the Google Classroom, what you have to do is reflection on case-based learning. Participants can reflect upon the differences between the present system of healthcare versus the interprofessional practice in managing the case discussed. So you have to reflect upon your experience of creating IPE team. Like now, Dr. Raghuveer sir has where he has worked with an IPE team. Do you believe that case-based learning had made easy to understand the interprofessional practice? Do you believe interprofessional practice will lead to a better care? And also the objectives are, your team is to take over a care of Mr. Nadeem. This is a case which has been put, who was admitted to the Yenepoya Medical College and Hospital 5 days ago with an acute episode of shortness of breath as a result of chronic obstructive pulmonary disease and fracture of the leg. Your task is to create an interprofessional team to take care for Mr. Nadeem, describe the role for each profession and can play in the treatment of Mr. Nadeem. In developing care for Mr. Nadeem, please ensure that you consider the composition of the team, identifying the roles and responsibilities of those involved. How will you ensure effective teamwork? How will you ensure effective communication? How will you ensure that you place the interests of Nadeem and his family at the center of interprofessional healthcare delivery? How will you plan for quality improvement and patient safety? Now, you have a lot of questions. I'll come back to it. Now, let us look into the case. Mr. Nadeem, aged 55-year-old, reports to the emergency OPD He's a known diabetic and an asthmatic patient from the past 12 years with a complaint of fractured leg, and hand is also sprained. The doctor assessed him and admitted him to the hospital. And after the preliminary results, only plastering of the leg was done, and the patient was admitted to the hospital for further evaluation. Mr. Nadeem also was complaining of toothache and was concerned about his oral hygiene and his ability to do the daily activities. Mr. Nadeem is living with his wife and two sons who are doing really well and living with the parents. So this is the case, and you have to look into all these components when we are planning any solution for him. Now, if you have a doubt in him, you have a doubt in your mind, how do we do it? The next session, that is the day 2, will teach you how to work in teamwork. How can you be a better communicator? How can you take care of the interests of Nadeem? What are the ethical dilemmas can come in? That is the ethical problems which can come in, and how dentistry. Because dentistry, majority of you feel that we are learning in silos. Now, how dentistry can play in interprofessional education. These are all the day 2 lecture sessions which we have designed for you, so that you can easily solve this exercise. So with this short lecture on case-based learning and a case scenario which has been put in your Google Classroom, which is one of the mandatory requirements for you to get the certificate. I request, I do not want an elaborate plan, definitely, but point by point you can always get in, and I will definitely assure you that I will get back to you your answers one by one properly. It might take some time because I may not give an answer immediately, because it's a two-way learning, but definitely everybody will be getting how interprofessional education, whatever you have put in, whether it is the correct way, or can you improve upon it. Okay, this is the way we can learn with, from, and about each other. Thank you.
Thank you, Dr. Imran. Now, moving on to the question and answer session. We have a question here in the chat box by DB sir. A lot of people are with CBL and UBS. So, how do you actually differentiate between them?
Yes, sir. As I said earlier, there are a lot of overlapping similarities between a case-based learning and a problem-based learning. Basic tenet, there are two differences. In problem-based learning, what the problem we give, that drives their learning. The problem drives, with the problem they try to find the solution. In case-based learning, we give the case, we give the scenario. Definitely, we give them also the lab investigations. There are certain added factors. Now, you can see in the case of Mr. Nadeem, I added that they are from a well-to-do family. It is carefully structured that he lives with two families, two sons, and he's living in the family, and they don't have any issues dealing with his care. So this case-based learning is carefully structured, taking into all the socio-demographic factors which we take in. Basically, in a nutshell, if I put social determinants of health, what social determinants of health, how it defines our health, all those factors are taken into consideration when we plan for a case-based learning. Here, the cases, what we put in, that drives their learning. So basically, when I tell about, you can see that I have carefully structured. There is fracture of the leg. Definitely, a role of a physiotherapist will come into picture. Now, my student has to collaborate with the physiotherapist for his opinion. How many days will it take for him for a complete rehabilitation? Definitely, I'm not going into the fact that orthopedician will come and do the surgery. That is definitely the case. That also has been done. Now, his rehabilitation also is important. It also depends on when his discharge will depend upon. The physiotherapist has to give a clearance, when he can be when he can be discharged. Definitely, ultimately, who is the leader? The physician is the leader. There is no question about it, or or the orthopedician is the leader. But an opinion has to be sought from the team who are working together. These kind of things which will come in, and this is what differentiates from a problem-based learning to a case-based learning. I hope I have satisfied the answer. And yes, sir, it's really good to know that you have conducted CBL, and I know that whom I have to contact for the next class on CBL.
Can I say a few words, Imran?
Thank you, Dr. Imran. Now, I have a question for you. You said there are two things, CBL and PBL. So, both are equally important for a student's learning, right? So,
Can
what
I say a
flow do
few
we
words?
follow? CBL first, PBL second. What should be the flow? I mean, like if we want to conduct for a student both CBL and PBL, so what should be the system?
Can I say a few words before Imran takes up?
Thank you for that question, Dr. Ume Amara. That's a difficult question to answer. What should I choose? Should I choose a PBL or a CBL? Well, there are a lot of teaching and learning methodologies which we can use, but I chose personally case-based learning because it becomes easier for me to convince somebody when I put an interesting scenarios. And as I already told, I am a public health dentist where we learn lot about social determinants of health. That's what drives the healthcare system. So if I do not emphasize on these factors, which are an important component, in ultimately the health of a person, it becomes difficult. So probably I am uh, a little biased when I say case-based learning, but definitely, it's up to the facilitator or an instructor to decide whether he has to go for a case-based learning or a problem-based learning. It's again the expertise one has. So, sir, you can definitely go in, sir.
Shall I say a few words, Imran? Can you hear me? Can you hear me?
Yes, sir.
You can hear me, okay. Now, problem-based learning occurs in two sessions. The first session of problem-based learning is what is called as brainstorming. The entire group of students of problem-based learning join together and go through the case scenario and brainstorm, and they divide the case into different components like unfamiliar words. There may be some words which they don't know, so they are supposed to carry a medical dictionary to the PBL, and they are supposed to clarify what is the nature of questions which they will ask, and finally they write down the learning objectives. I hope I made myself clear. The learning objectives are divided into different individuals. There are 20 individuals in the group. About 5 or 6 learning objectives will be divided into 5 or 6 people. Along with these 5 or 6 people, others will join them. So this is the brainstorming session. 1 week after brainstorming session, the discussion session will come. Discussion session. In the discussion session, they are supposed to tell about the learning objectives. Each directed learning. 1 week is given for them to SDL, to do as SDL, self-directed learning. They do a self-directed learning, collect as much information as possible, and then come back after 1 week to present the case in the discussion session. Whereas CBL, case-based learning, pertains to a real-life situation, something which has happened with a student or with a patient, as you rightly put with Nadeem, a real-life situation, something which has happened with, I had a case scenario, I wish I had known about your presentation, I would have brought it, a case scenario of one boy, one student, MBBS student, finally an MBBS student who had a problem, and I had used that as a case-based learning situation. So case-based learning is discussion of a case which is a real life situation. It happens in only one session. Problem-based learning happens in 2 sessions. So this is the major difference between the two. Thank you.
Thank you, sir. Thank you for giving us a wonderful insight into what is a problem-based learning and a case-based learning.
Yeah.
Thank you, Dr. Imran, and thank you, Raghuvi sir. Now we come to the end of today's workshop. Thank you all for attending the program today. We look forward to another brainstorming sessions of teamwork, communications, ethics, and interprofessional education in dentistry